Your birth date, ma'am.
August 13, 2010.
Okay. So, ma'am, I'm your nurse for today, and my name is Charlene. Then, I will assess your body, ma'am. First, your head, eyes, nose, mouth, and last, your ears. Next, perform hand hygiene. Next, wear gloves or clean gloves if necessary. Next, provide privacy by closing curtains or doors. Next, scalp, and hair.
Observe scalp in several areas by separating the hair at various locations. Inquire about any injuries. Note presence of flies, nits, dandruff, or lesions. Palpate the head by running the pads of the fingers over the entire surface of skull. Inquire about tenderness upon doing so. Observe and feel the hair condition. Observe the face for shape. Inspect for symmetry. Sensory function. Ask the client to close the eyes. Run cotton wisp over the forehead, cheek, and jaw on both sides of the face. Ask the client if she feel it and where she feels it.
Mo? Ano yung naramdaman mo? Saan ko nilagay tong cotton wisp?
Tungo ka? Dito.
Then,
Dito. Dito.
ipit ka.
Sensory function. Place a sweet, sour, salty, or bitter substance near the tip of the tongue. Normally, the client can identify the
Anong
taste.
lasa?
Matamis.
Can you smile? Frown. Raise eyebrows. Whistle. Okay. Puff cheeks. Okay, very good.
Palpate the eyelids for the lacrimal glands. To examine a lacrimal gland, the examiner lightly slide the pad of the index finger against the client's upper orbital rim. Inquire for any pain or tenderness. Sclerae. The sclerae is easily inspected during the assessment of the conjunctivae. Cornea. The cornea is best inspected by directing penlight obliquely from several positions. Anterior chamber and iris. The anterior chamber and the iris are easily inspected in conjunction with the cornea. The technique of oblique illumination is also useful in assessing the anterior chamber. Pupils. Examination of the pupils involves several inspections, including assessment of the size, shape, reaction to light is observed for direct response of constriction. Simultaneously, the other eye is observed for consensual response of constriction. The test for papillary accommodation is the examination for the change in papillary size as it is switched from a distance to a near object. Ask the client to stare at the object across room. Then ask the client to fix his or her gaze on the examiner's index fingers, which is 5 inches from the client's nose. Visualization is distant objects normally causes papillary dilation, and visualization of nearer objects causes papillary constriction and convergence of the eye.
LEPODPCT FDPLTCEO.
Cranial nerve 3, 4, and 6. Stand directly in front of the client and hold a finger or a pen light about 1 feet from the client's eyes. Instruct the client to follow the direction the object held by the examiner by eye movements only. Inspect the oracles of the ears for parallelism, size, position, appearance, and skin color. Palpate the auricles and the mastoid process for firmness of the cartilage of the auricles, tenderness when manipulating the auricles and the mastoid process. Inspect the auditory meatus or the ear canal for color, presence of cerumen, discharges, and foreign bodies. For adult, pull the pinna upward and backward to straighten the canal. Nose and paranasal sinuses. External portion of nose is inspected for following: placement and symmetry, patency of nares, flaring of alley, nace, discharge. The external nares are palpated for displacement of bone cartilage, for tenderness and masses. The internal nares are inspected by hyperextending the neck of the client. Ulnar aspect of the examiner's hand hard over the forehead of the client and using the thumb to push the tip of the nose upward while shining a light into the nares.
Ano yung amoy?
Labang.
Ano yung naamoy mo?
Alcohol.
Mouth and oropharynx, lips. Inspect for symmetry and surface abnormalities, color, and edema. Temporomandibular. Palpate while the mouth is opened wide and then closed for crepitus, deviations, tenderness. Gums. Inspected for color, bleeding, retraction of gums. Teeth. Inspect for number, color, dental caries, dental fillings, alignment, and malocclusions. Tooth loss, breath should also be assessed during the process. Tongue. Palpate for texture, inspect for color and lesions. Varicosities on ventral surface. Gag reflex, movement of tongue, frenulum placement. Last, uvula. Inspect for position, color, cranial nerve 10, which is vagus nerve.